Hello, my name is Dr. John Stanford, and I'm a practicing general surgeon in Western Georgia. My story is a cautionary tale regarding COVID-19. Anyone can get it, even me. I had discounted and minimized the early warnings as I likely contracted COVID-19 while on a family vacation in early March. Mild symptoms of headache, joint pain, and cough quickly worsened as I developed fevers, chest pain, profuse sweating, and most concerning, shortness of breath. I spent 8 days in the hospital each day worrying that my breathing symptoms would worsen. I was lucky. I improved without the need for mechanical ventilation. But others in my small town community are now fighting for their lives on ventilators in the hospital where I work. And yes, other people in the community that I serve have died from coronavirus infection. Now, 21 days after the development of symptoms, I still remain in my basement under quarantine. I'm getting better every day, but I still am very weak. I still have coughing fits. I still have exertional shortness of breath, even with minimal activities such as walking. Anyone can contract this disease. People with minimal or no symptoms of infection can unknowingly transmit virus to their friends, families, and co-workers. It is indiscriminate. People may suffer serious symptoms regardless of age, overall health, or pre-existing medical conditions. Do your part in disease prevention. Minimize your risk of contracting and transmitting COVID-19 through hygiene measures, personal protective equipment, social distancing, and shelter in place. Quarantine yourself if you have symptoms, document infection, or exposure to somebody known to have COVID-19. Let's all try to keep the number of COVID-19 infections down as low as possible. If our current hospital systems are inundated with COVID-19 patients, it's going to become increasingly more difficult to deliver the necessary medical care. And yes, unfortunately, more people could die unnecessarily because of that. It also increases the risk of exposure to my fellow physicians, as well as the nurses, ancillary medical staff, police and other first responders, and essential co-workers, including their families. Listen to me. Don't be a part of the problem. Don't make the same mistake I made. Don't discount or minimize the risk of this virus. It is serious. You and others could die. I'd like to thank all the medical staff that provided care for me while I was in the hospital. From the phlebotomists to the nurses to the doctors. Thank you, thank you, thank you. You really showed grace under pressure. I'd also like to thank all of the healthcare workers and first responders everywhere. Goodness knows the stress you are under just doing the jobs that you've done every day of your career. Please keep yourself and your families healthy by wearing your personal protective equipment. Thank you all and stay healthy.